Hi, I'm Catherine from Arcadia Physiotherapy. I'm going to show you some scar release techniques for C-section scars. Find yourself a nice quiet place to lie down. Lie on your back with your knees bent and your feet flat on the bed or floor. Just 5 to 10 minutes a day doing these stretches should really help mobilise your scar and reduce pain and tension in that area. For this massage, don't use oils, just use skin to skin so you get a good purchase on the tissues. Don't start this in earnest until after 8 weeks after your birth. This gives time for the tissues to heal properly. If you do experience any abdominal pain or unusual bleeding after 8 weeks, please do contact your GP. So this is my artist impression of a C-section scar. It's not technical surgical stitching, but you get the idea where the lower abdomen here can be quite flat, and then there's often a sort of belly or paunch slightly above it or a slight overhang, and that can be because the tissues have been pulled down and buckled under almost with the stitching, and that can remain there until we start to release this scar and open it up a little bit and flatten things down. The first scar release technique is just simple circular motions on the different layers of the abdomen. So taking 2 fingers, you'll find there's 3 layers. So there's the superficial skin, which should be fairly easy to move, but you'll find will be tagged along or tethered to the actual scar. And you just take 2 fingers, applying a medium pressure, so you're gathering the skin and the skin goes with you as you move, but you're not prodding too deeply. Just taking those fingers and then creating small circular motions along the scar in small steps, both above and below, at the sides as well. You can work in the corners there, which are often a bit tighter, and then actually on or along the scar if you feel comfortable to do that yet. Using the circular technique, you can also work on the deeper scar, which you will find slightly above or slightly below your external scar. So sinking your fingers in slightly deeper, have a feel around and see if you can find a similar knotty line either here or around here. Some ladies have it a little bit, quite a bit further up, but just have a search around until you find this second horizontal line. It should be quite palpable. And then using a similar technique, 2 or 3 fingers, just let your fingers sink in a little bit deeper until you can engage with that scar, and then do the circular motions again. This will be a bit more difficult, but you should find that as you pull the fingers around, the tissue kind of come with you, and then you've got the right pressure. Feeling a slight burning and pulling sensation, like a mini Chinese burn, but not to the point where it's too uncomfortable or painful. Second scar technique is moving the tissue in all different directions. So again, taking 2 fingers, placing them at the outside of the scar, pull towards the outside in small friction movements with a fairly firm pressure, but not to the point where you're feeling too much pain or discomfort. Then pull that same area downwards and upwards, and then pull towards the scar as well. So up, down and side to side with fairly firm pressure of 2 or potentially 3 fingers if you feel that's best for you. The third technique I call friction twists, and these also involve the area around the scar, not just the scar itself. So taking 2 hands, you can either use fingers for smaller areas, or you can even use the whole hand for larger areas around the pelvis and lower abdomen here. So you can take 2 fingers above and 2 fingers below and friction in opposite directions. So medium to firm pressure, just tugging that scar in opposite directions and pushing as well as pulling, pushing as well as pulling. And what you should feel is a slight sort of pulling, burning sensation, but not to the point where you feel any tearing or significant pain at all. And you can work along the scar and around the larger area. So you could do above and below, or even across this, say, lower area between the bony areas of the pelvis, creating laxity here rather than the tension that might be pulling on the scar to the pelvis. The final technique is called skin rolling, and this is a well-known massage technique, and it also works on and around scar tissue. Starting with the softer tissue above or below the scar, we sort of grab the soft cutaneous fatty tissue and just pull it away from the lower tissues. Again, gently but persistently. And then you can rolling across, gathering the tissue and rolling your thumbs in and then pulling with your other fingers across the tissues. So you can do that across the top and underneath. And even if you can get your fingers around the bits of scar, you can roll along there, or just roll small sections in your fingers like this. Just gently teasing it away from the lower layers, giving it some mobility through the actual scar. And you'll find some areas are easier than others and more tethered than others. And you can gradually work on those as your scar begins to release. You can finish with massaging in a plain oil such as almond, grapeseed, rosehip or coconut oil. Try to avoid using mineral oils like bio oil or baby oil. Thanks so much for watching. I hope you find the techniques useful, and please get in touch if you have any questions.